All right, Sir Dudu. So we're just going to get straight into it and ask the Minister's immediate reaction, just in light of one fatality that has been recorded here in Mpumalanga. Minister, maybe just your reaction to that.
Well, we have sadly learnt of the one person who has lost their lives, and we do wish to convey our condolences to the family and relatives. We also want to say thank you to the staff that had looked after the individual. What actually in this case happened was that the individual we did not report immediately, because I've been very strict that we should, by the time we announce, have a clear explanation, particularly the results. So a patient was admitted with a differential diagnosis, which means a suspicion that they would have been having COVID-19, and the doctors went to treat on that basis. In the process, they took some tests, and then by the time the patient had passed, the test had not been received. So when they were trying to put all of that information together, we then said that they shouldn't put the name on the statistics, because I want us to be sure that it's not something that once we have done, we're going to retract, like we did before. In the second patient we did announce in Cape Town, we were forced to correct it in public because we were in a hurry to say it was suspected. But in fact, when we realized that the results had said negative, we thought it was just fair that we must just always make sure. So this is really what happened in this case. It is a matter of concern for every life that we lose, because we want to always make sure that our system is such that it is able to look after everyone and recover. The part of the strength of our strategy in fighting COVID-19 is to make sure that we find whoever is positive, isolate them, and those who are positive, if they've got symptoms, if they need to be treated, they need to be treated properly. So case management is part of our main focus. Now, once they are admitted, a small number tend to have serious diseases or serious manifestation of the infection, and therefore they would end up being hospitalized or in high care or even ICU or even in ventilators. So when that happens, we want to make sure that the numbers ultimately are not so high of people who get to be sick and needing to be attended to. The general rule is it's difficult to know how many people are asymptomatic, but of the people that end up in hospital, it probably will be about around 20% or so, 20% or so, and ultimately about maybe another 10% will end up in ICU. So we watch out for those that they must be treated in such a way that they recover. So we therefore want to keep checking our system to see that there's adequate personnel, there's adequate expertise, there's adequate equipment to be able to give the best care that is possible. We have looked into that as we're discussing with the MEC. I'm quite comfortable that the level of care that's available in the province is such that it can match the problems that are coming from the manifestation of the COVID-19. So we will have to keep working on it, but at the end, we want to just make sure that everyone who comes in here gets the best possible care, and that's why I visited the hospital as well.
And obviously, Minister, it's a very big day today. You know, the schools have resumed, and obviously quite a lot of people are out in the road as you reopen the economy. Maybe just around the schools, will you continuously monitor the trends there?
Firstly, I think it's important for us to understand why government decided that we must open the schools. When we looked at South Africa, the way the pandemic has been unfolding, it is clear to us that the numbers of people who are infected are going to continue to increase. It is also clear that we will be with COVID-19 for a number of years, maybe 1 year, maybe 2 years, maybe a bit more than that. So during that time, it's impossible to suspend the lives of South Africans. It's impossible to say people must all stay at home. It's also impossible to say the children mustn't go to school. It's impossible to say there must be no economic activity. It's impossible to say continue the lockdown forever. It is not possible. And this we have found to be a major issue on our side, because we want to make sure that whilst we prevent the spread of the infection, We also want to make sure that people do not end up with a problem of hunger, lack of income, and economy that's going to collapse. So to balance that up, we've then been saying, President said we must have a risk-adjusted return to normality, which is what we're trying to do. So when we made a call to say that the schools should be opened, we sent a team of pediatricians and specialists to sit with the Department of Education. They made a lot of recommendations in terms of what the plans are. Then I actually assigned the entire Ministerial Advisory Committee to give us protocols and ideas of what needs to be done to actually help the children as they come to school. One thing I want to be open about is that this is a new situation, so if parents, if the communities feel that there are certain mistakes, there are certain challenges that they see, we're open. They must tell us that they're worried about this and that, and then we'll try and remedy all of that. What has happened in this case is that some schools have been able to do long-distance learning, e-education. In some cases, in the majority of cases, people don't have computers, they don't have iPads and laptops. In the rural areas, there's no connectivity. So we know that we can't do this education, e-learning for everybody. It therefore means that some of our children have to come back to school. However, as they come to school, we're not saying that let them get infected, no. We're saying that let's put the masks, let's help get our children to put, get sanitizers, they must wash their hands and so on. We must just teach the children. They do learn actually, and I'm talking because I've spoken to a lot of small kids. They're talking about what to do. When teachers have taught them, the children actually learn. I've got grandchildren, and one of them, in fact two of them, they actually said they wanted to demonstrate to me how to prevent the spread of COVID-19, and I realized that the teachers do a good job. So let's go out and teach our children. Let's go out and show our children that the mask. And I walked around and I saw little ones wearing masks now, small baby masks. It's very nice because it means we're getting there, but there are lots of things that we're going to find to be challenges. I'm aware that the families, the parents, are very nervous about it. I think we need to work together to try and see what is it that needs to be done to correct the situation. The teachers are nervous, and so at the end of it, we have to find a way to slowly adjust to the point where we have to move through. We discussed this issue quite at length with the Minister of Basic Education, and at some point we're even saying to Minister, it will mean that we might have to change the calendar for the year, and she was open. She said if that's going to help, they'll be prepared to do that. And then we then said, all along, we were not ready to discuss the issue of going back to school. We wanted the Department of Basic Education to first put a table their own proposal. Once they did the proposal, we then got in as Department of Health and said, okay, now this is how we're going to make inputs. We're going to criticize this, we're going to correct this, we're going to strengthen this. So I've got a team of specialists who have been sitting with the department. I would like to say to the parents and to the society at large, we're trying to normalize the situation. We do understand everyone is very nervous about it. Can we work together? Can we then make sure that we assist the children? Yes, when you look at the numbers of people who are infected, the people who are less than 20 years of age are not many. But it does not mean that we think children must just be left like that. They are also human beings. They are actually also susceptible. But of course, the conduct of the infection is not necessarily the same. So we'll keep watching on all of that. Where we think there's need to do additional investigation, to bring additional surveillance, we'll do all of that to just make sure that we understand better how the disease is manifesting. The only way to save anybody from getting the infection is to make sure that all of us wear masks. These fabric masks, the cloth masks, are the best. And everyone can make their own mask. They can even use their handkerchiefs. They can do anything. So we want it to be more affordable because all we need is a barrier just to contain the droplet fluids infection that would come from anybody. So that's really the main focus for us. And when we do so, we want to say to the communities, if we work together, we'll be able to get somewhere. Now, the problems that we are seeing in various provinces mean that the way the infection is spreading is not the same, which therefore means that there might be areas where we would say, please hold these schools here, but in some areas we might say, just continue. And so in some of the areas as well observing, we might have various restrictions. All of that is going to be as we see the situation arise. So when communities raise concerns, we listen and we take those into account. So that's really all I can say about it. We're watching what's happening in the schools, but we really want our parents to understand that we do understand their anxiety, and we also understand that it's important for us to return to normality. It might be a kind of a stepwise thing that we do. It might be staggered, it might be whatever, but we don't want our children to lose, the opportunity to be educated because it's not going to be now. It's going to be for a whole year, even up to next year, we'll still be battling with this infection.
All right. And Minister, when you look at the presidential newsletter, he spoke about the projected numbers and saying it's a different situation when it's just a graph. But now when we see the actual cases rising, it's a bit of a worrisome situation. And obviously you do face that enormous task of telling South Africans how they're doing in terms of the pandemic.
Well, we are very much pained by the fact that we have more people who are getting sick and that we are having more health workers who are also infected, that we are actually losing lives, and the numbers of people that we are losing, the number is increasing, and as the numbers of people getting infected increases, the numbers of those that might succumb might also increase. It is important for us to be alert to the fact that we can do something about it, and the way to deal with it is that each and every one of us takes individual responsibility to prevent the infection from coming to us and also prevent each one of us from spreading infection to the others. And therefore, the messaging is very, very important. Whilst we should not panic, we must also be aware that actually we have a much bigger burden of COVID-19 today when we had actually eased the lockdown than when we set it up. The lockdown happened when we had 927 persons who were positive. Today we are over 45,000, we are going higher, and when we've got those numbers, it basically means that we must all understand that this issue of COVID-19 is serious. It is serious, but it also can be managed, and the management of it is to make sure that we don't get everyone to be infected at the same time. We must stagger it, and we must try and flatten the curve and delay. Now, the lockdown for the first few days worked quite significantly to reduce the graph. I've seen a couple of articles, people are comparing how South Africa fared in the first few months. And of course, these are two types of epidemics. The first one was driven by what we call imported cases. So the more people came from somewhere where there was infection and came into the country, the more the infection increased, and that was doubling every second day. It was a very serious problem, because as soon as it crossed over to become an internal transmission, that meant that we'll have a much broader base from which the infection would have grown. And as soon as the lockdown happened, then the doubling rate was reduced to 15 days. Now, the rest of the country actually slowed down in terms of the increases, except in the Western Cape. Now, in the Western Cape, we ended up with a problem that was what we call a cluster outbreak that arose amongst the people who were in the essential services, in the food retail chains, stores, and those were in the factories, those were in the manufacturing of medicine and food processing and so on. At that time, the use of masks and distancing was not a big thing, and the sanitizing was still very weak. And as that happens, we're then saying that we discovered it when it had actually spread out into the nearby communities, in the villages, etc., where there's highly densely populated individuals, and that actually created a challenge in the sense that by the time we saw the numbers were now doubling and tripling and growing very fast, because the people who got infected had not themselves been early diagnosed early, and then we then needed to make sure that the people who are positive are isolated and quarantined. Now that also need to be strengthened in the case of the Western Cape, now in the Eastern Cape, because when we looked at the analysis, we realized that there were gaps that needed to be closed. So as I've been going there to the Western Cape, I've been to the Eastern Cape about 3 or 4 times each. We've been sorting out the response plan to make sure that it's stronger, it's aligned, and we've got all the challenges are attended to. I'm still quite comfortable that we're correct with the strategy, and the strategy that we're talking about is that on the areas where there's low transmission, we will keep them on what we call vigilance, which means that for every patient that they find, they must make sure that it's isolated, and that the contacts must also be tracked, and therefore they must be quarantined, and that they must be on the lookout and make sure that people who are vulnerable are given proper treatment and everything. On the hotspots, it's also important to say we have actually subdivided the districts into sub-districts, put up very strong teams that must work in the area of specialists, family practitioners, infectious diseases specialists, and epidemiologists, etc. And when they look at that, they must also make sure that all the people who are positive are isolated, and so that for the 2 weeks they are not causing any further infection, and those who are contacts must also similarly be quarantined. That is what we are doing now, and we need to make sure that we do that effectively, and most important is to deal with those who were diagnosed positive in the past 2 weeks, because that's really where the infection is being driven from. We will continue with this approach, but we must say that there may come a time where, when we look at it, we realize that all these efforts are not effective. There may come a time when we think that at the rate at which the infection is spreading, it will swamp and overwhelm the existing health services in terms of staffing, in terms of equipment, in terms of beds. And when that happens, we'll actually have to take a much stronger step at that level. And so we are watching on all of them. And so over a period, we will keep monitoring to see what other additional steps need to be taken. So the approach hasn't changed. We visited this area of Mpumalanga. We've been given a good briefing, and we're quite comfortable that they are on course in terms of the management. They've actually had about 176 patients, 102 have recovered. They are therefore managing the situation well, and we know that they must watch out for cluster outbreaks in Northern Cape, in Northwest Northern Cape, Limpopo, and Gauteng. Returning back to mines has actually created a lot of clusters. Now, those cluster outbreaks are actually a cause of concern. So in the next few weeks, we're going to start seeing the numbers soaring up, because we're now back normalizing activities. And the normalization of activities basically means that we are going to find more and more people who are going to become positive. We must just manage on the basis of the same strategy: change of behavior, social distancing, washing hands, sanitizing hands, cleaning up on and sanitizing at frequently touched areas, and also use of masks, wearing masks outside all the time. All of those are very, very important that we must deal with them.
All right, Minister, maybe as a final question, the issue of procuring the PPE for your healthcare workers, do you have the sufficient amount? Obviously, given the global shortage, I would imagine it's one of the challenges you face.
Right now, we don't have a shortage of PPEs. What we might be having are, distribution challenges in various hospitals. I've gone around. We've actually placed up orders, and we've got stuff delivered. For example, in the area of the Eastern Cape, where there are lots of challenges with between the unions and the department. In the last week, I actually sent a whole consignment and said to the department they must now have buffer stock to be able to intervene where it's necessary. We've been to a number of places and we've seen that what is a problem is distribution within a district. Sometimes one hospital has enough, the others don't have. One area has got the stuff stored and so on. The other issue is understanding what level of protection each one needs. So sometimes people believe that everyone must have coveralls, and they must have all the goggles, they must have everything. When in fact you don't need that. You only need that when you are dealing with a patient in the isolation ward. In that isolation ward, the issue is that that's where you use the full kit of PPEs. Now, in other areas, we use different levels of protection. And when you're dealing with it like that, you need to understand that sometimes someone thinks that they should be wearing this and that, and therefore they protest. But once you sit down, take them through, the major driver of this issue of concerns about PPEs is more the anxiety of staff more than the shortage, and therefore, but we need to make sure that where there's a shortage, we correct it. And so we will keep watching and looking at the areas where there are problems. We'll go there and make sure that they are corrected.
And Minister, personally, how are you dealing with this whole issue as a minister facing such a very massive task?
Well, firstly, I think we need to accept that this is a problem for South Africans, all South Africans. And therefore, one never really deals with it as a personal issue. We'd be dealing with it as an issue that all of us as South Africans have to face, because each one of us has got a role to play. And if we play that role, then of course we'll be able to have a better handle on the situation. Secondly, we've got very strong leadership coming from the President, the Deputy President, the Cabinet Ministers, and mayors and premiers and other councillors, leaders in church, leaders in communities, leaders in the faith-based organizations and NGOs, specialists, experts. So there's a whole lot of South Africans who are actually leading this thing, and all of us, are part of a whole broad team. Those health workers in the forefront, they are the ones who are making the impact, and those are the ones who are actually our real heroes, who are doing, day-to-day work, committing their lives, even if it means they have to face their risk to their own health and so on. Those are the people that we must always, look at and thank and say they are really our heroes. And so this is a combined work where we've got a whole big team, so nobody must ever feel that this is a one-man situation. Everyone must understand that the President is leading the whole show, the whole of Cabinet, the whole of society has to work together to fight this. And so all of us have got a responsibility, we've all got a role to play.
All right, Minister, thank you so much indeed for that comprehensive crossing. Really, the Minister talking about some of the issues that they are facing, but also detailing why they're here in Mpumalanga to try and assess the situation, but also saying that there are quite a lot of people really who have their hands on deck in making sure that South Africa is able to deal with COVID-19.